it is very important to give the patient the first opportunity to give you their rendition of what is going on. Everyone has a little different personality, both patient and doctor, but I am emphasizing the fact how important it is for after you walk in a room for a consultation with a patient you have never seen before, and almost always when you have a consultation with a TMD patient, you are never seen this patient before. Unless they are a historical patient in your practice, but most of these patients filter in from outside of your practice, certainly the way it is here in this practice. It's important that you introduce yourself, do whatever pleasantries you'd like to do, and then sit down and ask the patient to tell you about why they're there. What are the symptoms that they are trying to resolve? And let them talk. Listen to them first until they've satisfied that they've been able to tell you their story. In the area of TMD, I can promise you some of these stories can go on for more time than you want to sit there and listen, and that is true. I have my methods to somewhat cut the patient short, and I tell them I'm interested in what you have to say here, but what I'm really interested in is symptoms, not how many doctors you've been to or what all the other doctors had to say about this, or what other treatments that you were used and all the descriptions of the treatments and how they did this and did that but didn't work. Well, that's nice to know, I guess, but not necessary at all. What you're interested in is basic symptoms. And then as the patient gets to speak, give them the first opportunity. Not only will you learn what symptoms that they have, but you will learn something about symptoms that you may not have been familiar with, or symptoms that may or may not be associated with TMD, and you'll be able to sort out later. And I'll speak again in a minute or two, in a few minutes, about how to do that. This is, once you catch on how to do a good consultation, it should take you no more, maximum 20 minutes, most of the time 15 minutes. Probably a 10-minute consultation is a little too short. Somewhere between 15 and 20 minutes to do an ideal full consultation regarding TMD, and that includes, most of that includes taking the history. So give the patient the first option to tell you what their symptoms are, and then next, explain to the patient where you want to fill in the blanks of what other symptoms might be